We're jumpstarting your morning with a boost for your mental well-being at VITAHL. Folks there say they're committed to treating not just physical concerns that you have, but also the emotional and self-esteem challenges that often come with it. That's where we find our Jackie Kostek this morning. Hey, Jackie.
Audrina, good morning to you. Well, one of those self-esteem challenges often comes because of acne for boys and girls and men and women of basically all ages. So this is a before and after that we have from a process called AviClear. So this is the before and this is the after, which is a pretty incredible result. We're going to talk to Gigi, who is, she actually works here. She's 24 years old and she has been struggling with acne since she was a teenager. So Gigi, let's just first talk about how acne has sort of affected your life. And your skin looks amazing right now, by the way.
Thank you. Yeah, it just affected my how I felt every day and how the world perceived me. I was really scared to go out to social events, and I would cancel a lot of events, and I just didn't want to go out. So I tried everything over the counter, and really AviClear was just kind of the last resort for me.
Last resort. Okay, so you're going to lay down. This is nurse injector, certified nurse injector Bria Nolan again, and so she's going to show off this AviClear. And so Gigi had just mentioned that this is the last resort that she came to. She had done everything to try to help her acne, and this has actually really helped her. What is involved in this?
AviClear was the first FDA-cleared acne treatment. It targets acne at its source by minimizing sebaceous gland activity or oil production. It is a very tolerated treatment, 3 sessions spaced a month apart. People continue seeing results for a few months after their last treatment. Gotcha. It really improves confidence in people.
I mean, we've seen the before and after of this other patient over here. How do you see patients respond emotionally and like with their self-esteem after seeing real results?
I mean, it's clear in the photos there that patient is holding herself taller, she's smiling. It really makes an essential difference in everybody's skin, and we all just want to feel good in the skin we're in.
Absolutely. Does it hurt?
It's a little spicy, but definitely tolerable. As you can see with Gigi, she's doing fantastic.
Yes, okay. Gigi, I gotta come around and ask, what does it feel like to you to get this done?
It doesn't hurt too bad. It's kind of like a pinch, like a rubber band snapping, but it's tolerable, so it's not too terrible.
Okay, gotcha. Well, again, you look beautiful. Bria, thank you so much for your time this morning as well. So again, we're at VITAHL Medical Aesthetics, which is in the West Loop, and we're talking all things skincare this morning. So last hour we talked menopause. This hour was all about acne, and we're going to talk a lot more about what you can do to just improve your skin, especially in the summer months when you're out in the sun so much. Audrina, back to you.
All right, thank you so much, Jackie.
Jump-starting your morning with a boost for your mental well-being, among other things.
Yeah, at VITAHL, they're committed to treating, they say, not just physical concerns, but they also talk about the emotional and self-esteem challenges that come with really being human. Our Jackie Kostek diving into some of their self-care treatments.
We're back here at VITAHL Medical Aesthetics, and we were talking hair loss this hour, which is something that is absolutely devastating for women who experience it. I can speak for that myself, but I'm here with Stephanie and Dr. Sheila Patel this morning, and we're going to talk PRP, which is a specific kind of treatment that really does get great results for women who are experiencing hair loss. So, Stephanie, let's just start with you. And when did you start experiencing hair loss, and how did it look, I guess, on you, or how did it happen?
I started experiencing it about 3 years ago, and it just started with shedding. I started noticing more in the drain after I'd shower, and it was just, frustrating, obviously.
Yeah, I was going to say, was it, I mean, it's an emotional thing, your hair, because it adds so much to your overall look.
Sure, yeah. And I had, my hairstylist pointed it out to me, and then I realized I needed to do something about it.
Yeah, and you came here
Yes.
for PRP.
Correct.
So, Dr. Patel, what exactly is your role here first?
Yeah, so I'm an ophthalmologist and an aesthetic medicine specialist.
Okay, and let's talk a little bit about PRP. What exactly does that mean, and what are you holding here?
Yeah, so PRP is platelet-rich plasma. What I've done is I've drawn the patient's blood, I've spun it down to separate, and this is just some of the platelet-rich plasma, and the rest of it, which I've separated here. And this is the part that's rich in platelets, rich in growth factors, and then I will inject it back into her scalp, specifically in those areas of concern, which stimulates the hair follicle to grow and lengthens the period of that really robust growth phase rather than the dormant phase. It really makes a noticeable difference.
I was going to say, what is so special about the platelet rich plasma, that when it is injected back into the scalp, that it does do what you say it does and sort of reinvigorate the scalp and the hair follicle.
Yes, so you're essentially injecting back the most potent parts, the platelets, the growth factors, the things that will actually stimulate the hair follicle locally, in addition to what you're already receiving.
How often do you have to get something like this done?
So every 4 to 6 weeks is ideal. Usually we say a minimum of 3 to 6 treatments.
Gotcha. And after the 3 to 6 treatments, does it last for a while then?
Yes, so you kind of kickstart your whole system into a more robust growth phase. Results can be noticeable for up to a year, sometimes longer. If you've kickstarted that hair growth system, it can be very noticeable and impact the quality of life in a great way.
Kick-started or jump-started, because that's what we're talking about here. Stephanie and Dr. Patel, thank you so much for your time this morning. It is PRP, platelet-rich plasma, and it helps with people who are struggling with hair loss for any kind of reason. And of course, there's a lot of reasons why women and men lose their hair. Ladies, back to you.